All right, so it's 7 o'clock. I think we're going to get started. Welcome everyone to CCI Huronia's third webinar on COVID-19 and how to deal with this crisis in your condo. My name is Sonia Hodis and I'm one of the many directors on the CCI Huronia Board of Directors as well as a condominium lawyer. And tonight I'm your host and moderator. If you missed our previous two webinars, don't worry, you can watch recordings of those webinars. They're available on our website, ccihuronia.com. If you go to the resource content tab and click on webinars, you'll find those webinars there for your viewing. Last week in our webinar, we had a great lineup of topics and we talked about CCI's efforts to obtain necessary legislative changes for condos during the crisis, as well as reserve funds and borrowing. We talked about how condos are communicating with their residents, as well as updates on fire code compliance in Tarion. We had a discussion about force majeure clauses in contracts and construction delays, as well as a discussion about how to deal with requests for accommodation under the Human Rights Code during the COVID crisis. We had a pretty in-depth discussion about protocols for movings, showings, visitors, deliveries, and access to essential common elements, as well as whether or not condos can force residents to self-isolate and identify in light of the new mandatory quarantine provisions. So if you're interested in any of those topics, check out our website, ccihuronia.com, and watch last week's webinar. Also, don't forget to follow CCI Huronia on Facebook and find out about our upcoming events. As I indicated in previous webinars, CCI, the Canadian Condominium Institute, is a national organization and we have chapters across the country. In Ontario, we have 8 chapters alone, and CCI Huronia is one of those chapters. We've got people on this webinar from chapters across the province, and we welcome all of you and thank you for joining us. We've started something new tonight. We're inviting representatives from various chapters to join us as guests. So tonight from our sister chapter in Eastern Ontario, we have Nancy Houle and Justin Tudor, who will be talking to you a little bit later. In addition, we're very fortunate that Mayor Jeff Lehman, who is the mayor of the city of Barrie, is able to join us tonight, as well as Stephen Rabalato, who is the vice president of the Environmental Health Department for the Simcoe-Muskoka District Health Unit. So thank you, both of you, for joining us. As well, we have a panel who's going to be talking about cleaning, disinfecting, and beyond. And we've invited Mario Morano from Macintosh Perry, Stefan Decan from Paul Davis, and Eric Gano from Pure Clean to join us and give us some information in terms of what our condos should be doing to keep our surfaces clean. As well, we have some board members returning tonight to continue sharing their knowledge and insight. Mina Tesseris, John Jeffs, and Evan Scholnick, as well as Michelle Farley and Ashley Winberg, are back again tonight to talk to us a little bit later. So thank you all for coming, and thank you to the speakers for taking the time to prepare for tonight and for spending your evening with us. In terms of some housekeeping, I just want to let people know that we do ask you to mute your mics if you're on the phone, as well as mute your mic and shut off your video if you're online. We're doing this to try and provide the best recording that we can get so that people who are not with us tonight and are going to look at this video in the future will have a good quality recording, as well as trying to save the bandwidth to improve our recording. So your cooperation with respect to that is greatly appreciated. The other thing I wanted to remind people of is that we are not taking questions live, but we are taking questions through the chat box. So if you look at the bottom of your screen, in the middle of your screen, there's a little button that says chat. If you click on that, you can type in your questions, and we're going to be monitoring that chat box through the night and trying to answer those questions as they come up. If we can't answer them, we'll try and answer them at next week's webinar. So feel free to put your questions in there. Just make sure you send the question to everyone so that everyone can see it, and then everyone can see the answer as well. If you're having any technical difficulties tonight, I suggest you end the meeting and then log back in. If you're still having problems, end the meeting, and you can always log in by phone. If you go back to the confirmation that you received, you will see some phone numbers there that you can call in by phone and listen by phone if you're not able to do so online. I'd also like to just remind everybody that tonight's webinar is to provide information and insight into the issues that we're discussing. However, it's not professional advice you do need to contact your professionals and talk to them about your specific fact situation. Many of your professionals are still working. They're taking calls, emails, and doing video conferencing with clients. So please reach out to them and get the professional advice you need in terms of your specific fact situation. As well, things are changing so rapidly from week to week. We have different information. So the information in tonight's webinar is current as of April 7th, 2020. However, as things change, the information may not be relevant in the future or applicable at a future date. With respect to tonight's agenda, unfortunately, we weren't able to get that agenda out in advance of the meeting. So I'm just going to run through it so that everybody understands what topics we're going to be talking about and who's speaking, and then we'll get started. So Mayor Jeff Lehman is going to talk about seasonal residents and the Newberry Emergency Measures bylaw that was passed last week. Stephen Rebellato is going to be talking about enforcing quarantine and resources that are available in the community. Nancy Houle is going to be talking about domestic travel restrictions and rights. Nancy is a condominium lawyer from Davis & Houle in Ottawa. Mario Morano from McIntosh Perry, Stephen DeCan from Paul Davis, and Eric Gano from Pure Clean are going to be talking about cleaning, disinfecting, and beyond. Justin Tudor from Keller Engineering in Ottawa is going to be talking about delayed construction payments due to COVID and the new prompt payment legislation. Mina Tesseris, John Jeffs, and Evan Sholnick are going to be talking about ventilation systems. Michelle Farley is going to give us a fire code update, and Ashley Winberg is going to give us an update on changes to the essential services list that was released last week. So without further ado, let's get started. And Mayor Lehman, I'm going to ask you to start, and I understand that you're going to talk to us about the impact that COVID-19 has had on the resources locally and what people should be doing, as well as protocols in Barrie and the new Barrie bylaw that was passed last week. So Mayor Lehman?
Thank you very much, Sonia, and thank you to everybody for attending tonight. Welcome to my living room. The seasonal resident issue, I'll just touch on quickly. I think probably everyone on the call is aware that in Simcoe, Muskoka, local mayors, local public health have requested that people not use their seasonal residences to self-isolate. That's a very difficult message, I understand, because intuitively, people who own a recreational property may believe that they are safer because they literally have more distance or they're in a smaller community. Unfortunately, though, the same effect, it has the same effect on the capacity of the system, which is that, smaller communities in rural areas are not built to handle the kinds of demand on the healthcare system during peacetime, if you will, for the full seasonal population. And they certainly aren't built to handle a large influx of seasonal residents. So while that's not a major issue in the city of Barrie, it certainly is for many of our neighbors in Muskoka, in the north part of Simcoe County, and even in some places like Innisfil. So the request is not to self-isolate. I know that there are many people who come visit or wish to check on their properties, but the system simply isn't built to support the seasonal population. In terms of the measures in the city of Barrie, I declared a municipal state of emergency approximately 10 days ago, about the same time that many other large municipalities in Ontario were choosing to do the same thing. What that does really is gives us more tools to respond more nimbly as an organization to the changing day-by-day sort of crisis. And if I can put some context on it, there are currently 99 cases of COVID in confirmed cases in Simcoe, Muskoka. That's a relatively low number, and we hope that number stays relatively low. But of course, the peak is yet to come, and everybody is planning for the surge that is anticipated. So we know that this is a critical week for social distancing or distancing in Canada. It is every bit as much so in Barrie as elsewhere. So the emergency, declaration of the state of emergency gave us some additional tools, and that included the ability for me to pass an emergency order or bylaw to enforce some of those distancing requirements, which we did on Friday. The bylaw requires people to maintain a 2-meter separation in any public place from the people that they don't live with. It also makes it an offense for a business to conduct itself in a way that does not permit social distancing. So it forces the businesses that remain open to have regard for the fact that they need to allow people to distance. Third, and probably most importantly, it makes it an offense to use closed amenities, equipment, or facilities. And that, unfortunately, we saw become a major issue in Toronto and a little bit of an issue in other cities around the province, including Barrie, where families were using playgrounds that had been taped off, were congregating, pick up basketball games, those sorts of things, which unfortunately, people haven't got the message. We need the tool to be able to enforce. We are taking an education approach first before laying charges, but certainly the egregious examples, businesses that obviously are continuing to defy the order, or individuals who are tearing off the signs or the tape and those sorts of things, we are enforcing. I think I would just say more generally, as somebody who's trying to navigate our municipality through the crisis, when municipalities enter an emergency situation, it's often designed for something that hits in a big hurry, and then you deal with the fallout. You try and treat the victims, triage the situation, and then move on. The most apt thing I've heard said about COVID-19 is that it's a winter, not a blizzard. This is something that's going to be with us for months. And the actions we take need to consider the fact that if we can act fast, act well, have 100% compliance from the population in terms of what we need to do together, we stand the best chance of limiting the spread, not having the healthcare system overwhelmed, but also getting through it sooner. And if I can sound a hopeful note in conclusion to my opening remarks, it's that what we've seen around the world, particularly now in France, Germany, Italy, and Spain, and Portugal, is that flattening the curve works, that the distancing works to flatten the curve, that the lockdowns have an effect. They are not out of the woods by any stretch of the imagination, and it will be many, many weeks, if not months, before the restrictions can come off. But they're having some success, particularly in places like Portugal, in limiting the spread to the point where the healthcare system is more able to cope. Obviously, in Italy, that didn't happen, and in the United States, it's not happening. So the effort to flatten the curve, it does work, and the measures that we have asked of people and these very stringent changes to people's behavior and what we're asking of people is necessary, but we also know it's effective.
Thanks, Mayor Lehman. So if there's one thing that you would want to ask everyone on this webinar tonight to do to help the City of Barrie, but also the other municipalities that we have people hear from, what would be the one thing that you would leave us with?
Well, because you're the Condominium Institute, I'm sure everybody is giving a lot of consideration to common spaces in buildings. And that's a real issue. The frequency of cleaning, the manner in which people use those common areas is very, very important. So obviously, if there's anybody left who's still using a party room or having any kind of gathering, please help us crack down on that. I struggle to imagine anybody out there anymore who's not heard the message, but if that is still happening, it needs to stop. For other common rooms where people need to use them, laundry rooms or whatever that space might be, even parking garages and so forth, you really can't stick up enough signage. It sounds funny, but people have an amazing ability sometimes to not see 10 signs, but then they'll see the 11th. So if you have been through Barrie lately, you'll know we're doing curbside signage. We're plastering it on every channel, every radio station. And that's because for the next 2 weeks, this is the most critical thing that we can all do. So the efforts you can make as directors to try and make your properties, common areas of your properties, make people as aware as possible of the need for distancing, that's the best thing you can do to help.
And is there, I think I saw something on the weekend that there's a number that at least the residents of Barrie can call if they've got concerns about people that are not following the rules. Does Barrie have a hotline number that that people can call if they're concerned?
Yeah, we do. 739-4241 is our enforcement line, and we have a dedicated email, which is enforcement.services@barrie.ca. I always emphasize in this, we are looking for those egregious examples. I mean, it's not to say that it's okay for people to be walking 5 feet apart. They need to be walking 7 feet apart, giving people a berth on a pathway. But particularly what we want to stop and go after is anybody who is, using equipment that shouldn't be, or a party, that kind of thing is just not okay anymore. And unfortunately, it only takes one positive person at that party to create 20 or 30 or 50 new cases locally. And then, of course, it spreads from there. So we really do urge the use of that for the more egregious examples. But certainly, we're Canadians. We're built on peace, order, and good government. And I think the culture of compliance has been pretty good, I would say, locally. But there are still those who haven't got the message. So that's what the enforcement line is for.
Thank you, Mayor Lehman. I know you're going to stick around for a little bit. If people have any questions for Mayor Lehman, just put those questions into the chat box. Make sure you send them to everyone. And I'm sure if he sees your question pop up, if he's able to answer it, he'll do so. And if not, we'll try and follow up next week. So thank you again for taking time out of your busy schedule. I know things are chaotic for you right now as you're trying to help us all through this, but we really appreciate taking your time, and we appreciate the support you give CCI. So thank you again, Mayor Lehman, for being here tonight.
Of course, thank you.
All right, so moving on, we're very fortunate as well to have Stephen Rebellato. Did I say that right, Stephen? I'm hoping to get that right.
Yeah, that's pretty good.
Okay, great. To talk to us tonight, he's from the Simcoe Muskoka District Health Unit. He's the Vice President of the Environmental Health Department. And Stephen has not only worked with Simcoe Muskoka District Health, but he's also worked with York Public Health during the H1N1 crisis and the SARS crisis. So he's got a lot of experience in terms of these types of situations. So Stephen, there's three things that you're going to talk to us tonight about. One is the ability of public health to enforce these orders that are out there right now. And you're also going to touch on some resources in Simcoe Muskoka that people might find helpful. And then you're going to provide us with some general advice for condo dwellers specifically. So I'm going to pass the mic over to you, and I know we're all excited to hear what you have to say.
Thank you very much, Sonia. And our medical officer of health, Dr. Charles Gardner, sends his regrets, but also thanks to the Institute for having us here today. Also wanted to send a special thanks to Mayor Lehman and the City of Barrie, who have been a superb partner for the health unit in terms of a number of different initiatives that we've embarked on together throughout the COVID pandemic at this point in time. I think everyone's aware that globally, this has been an issue from China to Italy to Western Europe and North America, and the span of impact of to our communities has been vast, from speaking about a number of things from health to the supply chain to all these various restrictive measures that the mayor had touched on as it relates to limiting specific freedoms that we may have taken for granted before, and I'll be speaking about a few of those over the next couple minutes. But I think the message of isolation and physical distancing and hand hygiene have really been dominating the global message, and really given a lack of vaccine and other medical interventions to control COVID-19, really that's what is at our arsenal in terms of us as communities, us as those in condominiums, in order to reduce the spread. So locally, the health unit's been involved with significant planning and response activities since the outbreak initiated in China many months ago. Seems like years at this point, but certainly the majority of our agency resources have been focused on COVID response, as we're quickly learning that all aspects of our communities and facilities have been impacted by the pandemic at this point in time. So this has really been significantly impacted to our communities, and therefore our relationships with our various municipalities within Simcoe Muskoka has been vital And that relationship is really important as we, continue on building relationships, in particular with our healthcare systems, from hospitals to long-term care, all the things I think all of our audience here is likely familiar with, heard it on the news in terms of our long-term care facilities and our hospitals that are most vulnerable, and those populations. That's really been a focus of ours in addition to the general population at hand. So there was a request to talk about quarantine and isolation, and I think it's important just to step back quickly in terms of understanding these concepts. The concept of self-isolation is really a novel concept as it relates to language that's been used since the inception of this pandemic in conjunction with the use of the word quarantine. So I'll say that self-isolation has been common language, and it's really came in conjunction with the majority of travel that's been coming back into Canada since late February, where the federal government has told people to self-isolate. Now, there's a number of lawyers in the room that realize that terminology, if they're familiar with things such as the Federal Quarantine Act, really don't hold a lot of weight unless they have that regulatory authority underneath what it is that they're required to do under an order. So self-isolation and this invoking of the Federal Quarantine Act are two very different things. So as of March the 25th, the federal government, for those return travelers coming back into Canada, has required people under the Quarantine Act to be quarantined. And that is a specific order that is geared towards an individual and requiring them to be isolated or quarantined for 14 days. Prior to that, there was really no enforcement teeth associated with that federal piece of legislation because it wasn't being used. But upon entry into Canada at this point in time, you have individuals who are in receipt of an actual order from the federal government to remain in quarantine. So the complexity associated with the broad federal legislation locally is actually quite complicated from the perspective that the Quarantine Act cannot be enforced locally by your local public health unit because the Quarantine Act requires what's called peace officers to be able to do that. So the general question is, well, who are peace officers? Peace officers, as an easy example, are those in a police force. So there hasn't been a tremendous amount of clarity in association with the various detachments across the province. And of course, I'm only speaking to the province of Ontario and not specifically outside of that. But in this point in time, we have a phone number that is listed on the federal website to be able to call and ask questions about that. The enforcement framework will be rolled out, as we understand, in very short order about who the general public can call for those that may not be abiding by those specific orders. So the other piece that we have at our disposal at this point is the Ontario Health Protection and Promotion Act. This is a piece of legislation that is enforced locally through our public health units. At this point in time, there's only been a couple of health units that have issued broad orders to communities. Two come to mind, City of Toronto and Peel Public Health, where they have said to the community, if you are COVID positive, you are therefore ordered to stay at home for 14 days. They have not, or at least they haven't communicated this broadly, to provide very specific individual orders to individuals that would go to, say, John Smith to be quarantined for that period of time. But once that order is actually issued by health units, we've seen general compliance, I would say, in terms of our observations in Simcoe Muskoka at this point in time. And therefore, we haven't invoked specific orders yet. But what I would say is when we do issue those, there is a requirement for the health unit to ensure that that order is taking place. As I'm sure the audience can envision at this point in time, all of our resources have been completely diverted over to COVID-based response, and primarily to case contact investigations where there is a lot more value. And I'll say that for those that have had individuals in Simcoe, Muskoka or elsewhere that have been deemed positive for COVID, what the local health unit will do is follow up with those contacts in order to ensure that those contacts are either tested or advised to check generally for symptoms related to COVID in order for them to be aware when they should get tested at the various local assessment centers that they might find in their general area. So as it relates to condominiums, I know that the agenda has a number of speakers. So, generally what we have on our website, simcoemuskokahealth.org, is a number of different aspects of various businesses and facilities. Included in that are multi-unit dwellings or condominiums. But really, I'm echoing a lot of the things that Mayor Lehman has suggested in terms of postponing any non-urgent inspections or renovations or repair work, to close all on-site amenities. So this is a part of that: orders, pools, gyms, and gathering spaces. Of course, there's the order to limit gatherings of less than 5 people in general. That's a part of that provincial emergency order. Obviously, families that are greater than 5 individuals are exempt to that. Frequently touched items in terms of cleaning and disinfecting, making hand sanitizer stations available, and anyone, of course, recently returning to international travel should self-isolate for 14 days. One of the key pieces, I think, in terms of our communities, though, in terms of that self-isolation, is ensuring that you check with your local health unit and you check with those social service agencies across the board in terms of your municipality, in terms of mental health supports and community supports for things like groceries or income supports, which are vital given, anyone on the line. And I see a lot of backgrounds with people at their homes, and there might be some who are actually self-isolating, know how difficult that can be, in particular if you're in quarantine. So really looking to those agency supports that are in our communities, agencies like United Way, who are able to assist those who are significantly isolated from individuals, to give them a helping hand, I think is key. So our messages of physical distancing, hand washing and hand hygiene, and isolation and staying at home have been paramount, and that'll continue moving on into the future. I think, Sonia, you had asked about, the different agencies. We have a Health Connection line that anyone in Simcoe, Muskoka can contact, 1-877-721-7520. And as I had mentioned, www.simcoemuskokahealth.org for various pieces of information and guidance documents that you and those residents in your dwellings can be assisted with. Thank you.
Thanks, Stephen. I see there's a lot of questions coming in the chat line that perhaps Stephen could answer. If you have some time, Stephen, take a look at the chat line. If not, we might have to have you back
Sure.
on another webinar to answer some of these questions.
Okay, great.
All right. So moving on, Nancy Houle, who's a condominium lawyer in Ottawa from Davison Houle and is part of our CCI Eastern Ontario chapter. In fact, she's the president of that chapter, is going to talk about domestic travel restrictions and rights. Nancy, I hear the bridges are closing in Ottawa, Quebec. Can you tell us what that's all about?
Yeah, thank you, Sonia. So that is pretty much going to be my story today. Mayor Lehman has already talked about limiting the use of civic residences. He talked about restrictions on rights and liberties. My talk over the next few minutes is going to touch on both of these. As Sonia was saying, I practice condominium law in Eastern Ontario, but while I work in Eastern Ontario and specifically practice in Ottawa, I actually live in the Gatineau Hills in Western Quebec. So I'm saying hi to you right now from Western Quebec, where we've been on lockdown for quite some time. Every day I travel to work and home in between 2 provinces, in between Ontario and Quebec. So the other day when Sonia and I were having a discussion about some of the issues that might affect various jurisdictions, we talked about the particular living working arrangement that I have, which has arisen an interesting situation as a result of this pandemic, the implications of domestic travel restrictions. Over the past week or so, 8 provinces and territories in Canada have set up border checkpoints and/or travel restrictions. In some cases, the purpose of the checkpoint is education, making sure that people are aware of the dangers of traveling during the pandemic and the increased risk of spreading from province to province. In other cases, provinces are enforcing travel restrictions as between themselves, ensuring that those who are traveling are not doing anything for anything other than essential purposes. For example, in Northwest Territories, all non-residents are banned from entering, with the exception of a few exceptions. In my neck of the woods, on March 31st, Canada's capital region was essentially divided. The bridges between Ottawa and Gatineau were closed to non-essential travelers coming from Ottawa to Quebec. Most people really only had a few hours notice. I was lucky, I had a little bit more than that, so I was able to make some preparations in anticipation of the closure. Travelers are still permitted to cross into Ottawa, but traveling to Quebec is prohibited except for essential services. The police set themselves up on the bridges and were checking vehicles. There was quite a big lineup for the first couple of days as vehicles were checked and passengers were asked why they were traveling into Quebec. For example, if you're working on one side or the other, that's an acceptable exception. In one case, one of our friends was delivering goods and essential food to their elderly parent living in a condo in Quebec, and they were allowed to cross over, but were given a warning to make sure that it's only done so infrequently and as needed. So in the Ottawa-Gatineau region, we certainly do have a unique situation with the large number of residents traveling over from each province to the other. And so, as many of you participating this evening might also know, we also currently have the highest number of provincial cases of the virus in Quebec. One of those reasons really does stem from the fact that the March break here in Quebec was 2 weeks ahead of Ontario. So we did not yet have our travel restrictions in place, and people weren't yet told to cancel plans. So we are a bit ahead of Ontario, and hopefully we'll be reaching our peak very shortly. Another important factor, though, in my view, and one which stems from some of the issues that both Mayor Lehman and Steve were talking about, is that we also have a high cottage area in the Outaouais region. I'm sure many of you know about the large number of cottage condos in the Mont Tremblant area and heading up towards Mont Tremblant. So a large number of residents in Ottawa have cottages in Western Quebec. And I'm pretty sure that that is one of the key reasons that they focused on closure of the bridges in the capital region. I'm also pretty sure that that was why there was very little notice given as to when the closure was going to be enacted, because I can tell you from firsthand experience, at least 4 or 5 of my friends have told me that if they had known the bridges were going to be closing, they probably would have retreated to their seasonal cottages to ride out the rest of the pandemic. So while we're in a unique region here in Ottawa, it did make me start to think, well, what about other jurisdictions across the other provinces? For example, as Mayor Lehman was talking about, cottage country up in Huronia and Barrie and the various other jurisdictions. So my message really is, I think we all need to be thinking about and be prepared for the possibility that our travel could be limited at any given time. We have to think about the fact that our hospitals and our medical systems in the smaller jurisdictions just can't cope with the influx of residents, as we've been told by Steve. We also don't want a whole bunch of people on the roads. If you're in an accident, that increases the strain on the medical professionals and the first line responders. We also need to think about the fact that the cottage country, and particularly the cottage resort condos, are also not ready for the influx of residents and won't be permitted to be ready. We have several condominium corporations that we're aware of in the Prescott area through CCI who have been actually receiving notices from the municipality with orders on what can and cannot be opened in their particular cottage condo resorts. They've received notices saying you are permitted to open only the water, sewage, and hydro facilities. Everything else must, of course, be kept closed, including the docks, including the beaches, including the pools, public showers, outhouses, etc. So again, just a bit of a cautionary tale from someone who is directly impacted by the closure of the bridges. For those out there who are thinking of perhaps I might want to retreat to my cottage, you have to think of a couple things. At any given point in time, your mobility could be restricted. There could be additional travel restrictions. Secondly, where you might be wanting to go may not be able to handle you getting there and may not have the ability to open even if you did get there.
Thanks, Nancy. So I guess you guys have seen the closure of the bridge. We may see the closure of the 400 at some point down the road.
Well, I can tell you that on Highway 105, which is one of the primary highways traveling that does give you the ability to go from Ontario to Quebec, they are doing blocks there and checking as well.
Yeah, thanks. So moving from bridges to cleaning, we're very lucky today to have a panel of people who have some expertise in cleaning and disinfecting. And so I'm going to start off with Mario. I know the time is just flying by tonight. So Mario, can you start us off and give us some sort of general background about the protocols and things we should be thinking about? And then Stefan and Eric are going to talk about two possible options that are out there right now. So Mario?
So thank you very much. Thank you for having me all here this evening. So my name is Mario Morana, and I'm the Hazardous Materials Environmental Health and Safety Manager at McIntosh Perry, and we provide environmental health and safety consulting services to a wide variety of clients to help them navigate through their indoor environmental concerns, and we also work closely with environmental contractors. So today we want to talk about the cleaning and disinfection methods and procedures that are being used in the industry. And the reason is primarily due to the COVID-19 outbreak, and moreover, as it relates to the need for cleaning and disinfection of commonly touched surfaces. As Sonia mentions, we have some representatives here from various environmental restoration companies, and they will be providing us with some details and insight into the products and cleaning methods that they've been providing, which may be useful for you. But to start off, I understand that there may be a lack of clarity surrounding what is meant by cleaning, what is meant by sanitizing, what is meant by disinfecting, and also the products that we should be using during the cleaning process. So there are multiple degrees of cleaning we should be considering, and it's important to understand the differences between them. In general, there are 4 different levels. There's cleaning, there's sanitizing, there's disinfecting, and there's sterilizing. And us professionals in the environmental consulting and restoration industry, we often refer to the Institute for Inspection, Cleaning, and Restoration Certification. And they've provided some definitions. So cleaning is the traditional activity of removing contaminants and pollutants and undesired substances from an environment or a surface to reduce damage or harm to human health or valuable contents. So this is basic cleaning methods like sweeping, vacuuming, dusting, washing. Then we move up a notch to sanitizing. Sanitizing is the act or process of reducing microorganisms to safer levels. And we do that by using a chemical agent that limits or controls microorganisms, thereby creating a condition of acceptable health risk. When we go up a notch further, we get into disinfecting. And that's the act of applying a disinfectant. And that is a chemical that's used on objects to destroy more than 99% of unwanted organisms. And that includes bacteria, fungi, viruses, and it eliminates them below the level necessary to cause infection. So some disinfectants include your sodium hypochlorite, your quaternary ammonium compounds, and hydrogen peroxide. Beyond that is sterilization, and that's the use of a physical or chemical process to destroy all microbial life, including highly resistant bacterial endospores. So that's basically what they use in hospitals, in operating rooms, in disinfecting instrumentation and autoclaves. So that level is basically a really high level, which we're not really going to be discussing. But given the descriptions that I've provided, it's important to consider the level of cleaning that we are aiming to achieve at various sites and properties. So basically, we're aiming to, at a minimum, clean, sanitize, and also reach a level of disinfection on commonly touched surfaces. So how do we achieve this? Do basic cleaning methods take disinfection into account? So what we've come to realize is that basic cleaning doesn't always capture the degree of disinfection we should be aiming for on certain surfaces. I'm a member of the Environmental Abatement Council of Ontario, and they have put together recently a guideline that's titled Emerging and Existing Pathogen Cleaning and its Best Practices for Environmental Professionals. The document is intended to provide a general protocol for detailed cleaning and application of a disinfectant to general surfaces. The goal being to provide an enhanced level of disinfection that you couldn't otherwise achieve by basic or standing cleaning procedures, thereby reducing the potential for transmission through contact exposure. It also outlines 3 risk levels from precautionary cleaning to potential contamination and confirmed contamination. And for the purpose of this session, I think we'll be focusing just on what would be precautionary cleaning. So basically, if we consider that level of cleaning as a minimum, then we will be significantly improving the cleanliness and reducing potential of transmission through contact exposure. So precautionary cleaning, or level 1 cleaning, does involve some specific cleaning steps, and there are various products and applications that environmental contractors can use. But keep in mind that some of these measures need to be tailored to the areas and spaces that need to be cleaned. There's also a wide variety of disinfectant products on the market that are classified as having broad spectrum efficacy capabilities. This means that they are effective against bacteria, fungi, and viruses. It is also recommended that only products that have a Health Canada drug identification number be used as a disinfectant, and they should also be applied according to the manufacturer's instructions. Some of these products have varying degrees of dwell time that's required when they're applied to the surface. So at this point, I'm going to pass it over to Stefan from Paul Davis, and he's going to further explain some of the means and methods that they're using. Stefan?
Well, thank you, Mario. So my name is Stefan DeCane, and I'm the president of Paul Davis, Simcoe County. Not something I wanted to become an expert in, that's for sure. And we've all, unfortunately, become experts at this, trying to solve this mystery of COVID, coronavirus. But every day we get more information, and matter of fact, today we just got the word that one of our disinfectants we use, Benefect, has been approved by the EPA and put on their N list. And it's the only product on the N list that is actually green, which is good to know. So since the advent of Corona started, we've been, I guess, running to the fire. We're involved with RVH in cleaning their COVID clinics. We supply the cleaners and the product for that. We're involved with cleaning out EMS and police vehicles. We're also involved in the cleaning and application of disinfectant on commercial enterprises where they've been either potentially COVID positive and have been forced to shut down, and then we've been able to open up again. So unfortunately, we've got more experience than I'd really like to say. But in your case with the Condo Corps, we find that probably the best solution is to be able to clean and, as Mario explained, disinfect. And disinfecting is the key. We use 2 products. We use a hydrogen peroxide, a 3% solution of hydrogen peroxide that we actually use where we actually use as wipes. We can wipe down any what we call high touch surfaces now, a new term. Door handles, most horizontal flat surfaces are getting wiped down. But that produces a gap, and the gap is then filled by us fogging. We use an ULV fogger and applying the disinfectant Benefect. That requires 10 minutes of dwell time. So dwell time means it has to be on the surface for 10 minutes in a wet state. So obviously nobody can be in the room. And we apply that with proper application of PPE. But the fogging gives us the opportunity to get into all the nooks and crannies and really deal with just finding spots where it's not been before. The advantage of using Benefect, which myself and Eric and others in our industry use a lot, is that we can spray it and leave it. There is no, it's less toxic than vinegar. It's actually thyme oil. It may not smell. Some people like the smell, some people don't, but it definitely leaves a bit of an odor, which brings me to my next point. So talking about fogging, and Sonia asked me that to say, well, what are the 3 big reasons for fogging? I got to say the first one is, as I talked about, it effectively reaches all surfaces. When it does that, it works. It's plain and simple. The other thing about fogging is it's actually inexpensive. Think about the concept of wiping all the surfaces down, the labor involved in that. Fogging is just walking around with a ULV fogger and spraying everything. So it's less expensive labor-wise, and so therefore really paying only for the product to be applied. And since there's no wipe-off required, we can leave it. And after 10 minutes, you're good to go. And the third thing, and this is the most important thing, is the peace of mind that the work is complete. There's a bit of a lingering order, but the fact is that the peace of mind among your residents, among your board, and among everyone else that's out there, it's important that they understand the peace of mind that you are now let them have by using this. And by having somebody that's a professional apply it, whether it's ourselves or other contractors in the industry, and Pure Clean and Eric are doing a great job as well. That's where we need to stay, and that's where you need to go.
So Eric, you've got another process that you guys use that creates a barrier. Can you tell us about what that is and what the benefits of that is?
Sure. Following up on what Stefan said, we are a restoration contractor, and we do the very similar thing that we concentrate on cleaning and then disinfecting and applying Benefact or other disinfectants. But the trouble with any disinfectant is that it stops working the moment it dries. And although you may have cleaned all the surfaces and removed microbes at that point, well, what happens later on? What happens when the next person touches it? What happens as you go through the day? So what we have developed is a process that we work in conjunction with a product called Aegis. And it's a 3-step process where we clean the surfaces, we apply the disinfectant, and then we apply a microbial burial shield. Product that we use is Aegis. And it's an extra step to reduce the risk in high touch areas. And combined with proper cleaning, it's the best that can be done at the moment. What Aegis does is currently applied by technicians by wiping it on surfaces. And as we said, high touch surfaces, doors, lobby furniture, mailboxes, elevator buttons, railings, laundry rooms. We wipe it on the surfaces, and it provides essentially a bed of nails. So the microbials, as they try and land on it, they actually can't stay on it, they can't propagate, they can't grow, and they can't live. The burial shield that we've used, the micro burial shield, has been used in various spots. PureClean has recently been working with Metrolinx and applying it on their trains and in their buses and in their stations, like I said, in the high touch areas. We're also working with the food distributor in warehouses so that as the food is distributed out of the warehouses, all of the workers within it are safe, and they know that the areas, their high touch areas, have been treated by this product there. Because the last thing we want is our warehouse staffs to be contaminated and to be shut down, and then we can't get the food out of the warehouses.
So Eric, in condos, where would be the most or the best use for this type of barrier?
Well, as I said before, the barrier is best used on touch points, common high touch points. Think of it when you're entering in your condo. You grab the door handle. You may grab the end of the door if it's half open, half closed in a windy spot. You come in, you touch the mailbox. You touch the elevator button. You may grab the handrail in the elevator. If you go up the stairs, will you grab the doorknob? Did you touch the touch bar? Did you grab the stair railing going all the way through there? You then go down to the laundry room, well, the washing machine, the light switch, areas that people touch constantly and areas that multiple people touch. Those are the most areas that we want to concentrate on to making sure that we're reducing the transmissibility of one person's germs residing on a surface and then another person touching that same area.
Thanks,
so if
Eric.
anybody is out there, just watch through the next time you go through a building, what surfaces you touch.
Thanks. Eric, I'm going to direct you to the chat line because there's a couple questions for you specifically, so maybe you could answer those. And Stefan, there's also a couple questions for you there. We're slowly running out of, or quickly running out of time, so I'm just going to move us forward. The next topic we have is being presented by Justin Tudor, who's an engineer from CCI Eastern Ontario chapter, and he's just going to talk to us a bit about delayed construction payments and the new prompt payment legislation and why we need to even think about this during COVID. So Justin?
Thanks, Sonia, and thanks CCI Huronia for including CCI chapters throughout the province. I have a topic here that's super relevant to the whole province. I've been talking about the changes to the prompt payment, the Construction Act and the prompt payment regime and how it affects condos over the last few months. And it's more than relevant now, as condos are undeniably going to have questions and issues with paying their bills, if not at all, but maybe even on time. As a bit of a primer, the Construction Lien Act was the law of the land since 1983. The new act was developed over 2018 and 2019 and makes two fundamental changes with regard primarily to holdback and the institution of a prompt payment regime. Holdback changed from 45 to 60 days. There's nothing more to say about it. The prompt payment regime is an entirely new avenue of the Construction Act that everybody's going to have to deal with. Very briefly here, the standard payment provisions in a CCDC contract or in standard contract terms were you send the invoice to the consultant reviews it within 10 days, the consultant sends that invoice off to the owner, and the owner has to pay it within 20 days. But we know it's condo. That never happened. The board's going to read it. They're not going to meet for 3 more weeks. They're going to have questions about the check. So they were seeing, especially in condo, payments aren't happening for 60 or 75 days, even in regular, even when there's no issue with the invoice. The prompt payment is meant to affect all construction, not just condo. And very briefly, the biggest part about it is when a proper invoice goes to the owner, if the owner can't pay that in 28 days, they have to have provided notice 14 days after the invoice was received. So they have to pay 28 days after the invoice is submitted unless they provided notice. Notice has to be on a very specific form called a Notice of Non-Payment Form, available on ontarioconstructionforms.on.ca. It's Form 1.1. So this 28-day payment period can't be contracted out of. You can't have an agreement that says payment terms are 45 days, and it affects all construction projects. So that's good to have a new rule. People have been ignoring construction rules for years. They also created this adjudication body that works a lot like the CAT. It's a separate authority that's created to resolve payment disputes very quickly. For a very small fee proportional to the invoice, a tribunal will judge the value of whether a payment should be made or not within anywhere from 4 to 35 days. So it can happen very quickly. So as an example, if an owner doesn't pay the invoice at 28 days and they didn't provide a notice, the contractor has 7 days to send them to this tribunal that exists and will be used. The tribunal can evaluate whether an invoice should be paid, the value of the invoice, whether the extras are reasonable, whether additional considerations should be paid. And it can issue orders that look like court orders. So if you don't pay the decision of the tribunal within 10 days, they can go to the bailiff and get the keys. It's issuing like a court order. There's obvious problems with this, and no short presentation can cover it. There's no rule for a consultant to review your invoice. There's no allowance for it. A proper invoice cannot be based on a payment certifier saying it's okay. As soon as that proper invoice, hits the owner's desk, the 14-day clock starts. And if you can't pay it by 28 days, you could find yourself in a tough negotiating spot or in this new tribunal. The other issue is checks goes fast. If boards aren't meeting more than once a month during a major construction project, they won't be able to respond to the issues quick enough. Also, this trickles down to subs. If contractors don't send the owners to the ADR within 7 days after non-payment, they'll be exposing themselves to the same type of risk of the tribunal to their subtrades. So this is going to be a thing. How does this affect the time of COVID? It's so very important. In the short term, you're more likely to have projects that you can't pay the check because someone's in quarantine. So, or someone's in self-isolation, or your procedures haven't ramped up to survive both the prompt payment legislation and self-isolation. So it's important, if you don't expect to be able to pay the invoice by 28 days, fill out the notice of non-payment form 111. At least there's an official record of your defense of here is why we can't pay it. We can't pay this much because Joe, who signs all the checks, is locked in his house. Put it on the form, file it with the contractors. And the longer term, everybody has to be thinking that this year, contractors in Ontario have a better tool for getting, once you've engaged with them, for getting the money out of the pockets of the owners. This won't be something that will be able to be avoided. When this is a tool that everybody can use, you must be very conscious of the projects that you enter into and your ability to make sure you can deliver cash, not just for the project, but for the project on time. All property managers and owners, make sure your signing authorities are in check and that you can sign checks quickly when there's no dispute about them. It's a complex issue. It needs more than 5 minutes, but pay attention to it because it's going to be a thing this year.
Don't forget the form. Another form that condos need to worry about. All right, thanks, Justin. Next, we're going to talk about ventilation systems and whether it's something we should worry about. So Mina, can you give us the lowdown on ventilation systems, and is this something we should be worrying about right now?
Sure, thanks, Sonia. I'll try and make this quick because I know we're running out of time, but really the question that people are asking, or some people are asking, is whether or not there's a risk of COVID-19 virus transmission through the building air handling system. So what that means in a multi-story condo is your common element air handling unit that's usually located as a rooftop unit or in your parking garage. And what it does is it supplies fresh outdoor air to the corridors and the common areas of the condo. So currently, the global medical community has told us that the virus is carried in respiratory droplets, and it's transmitted directly from person to person or through fomite transmission, meaning that you make contact with a live virus on a contaminated surface, followed by contact of your hand to your eye, nose, or mouth. There's currently no evidence that suggests infection is caused by airborne transmission. And the global medical community have done a tremendous amount of follow-up with infected patients and found that the mode of infection, again, is through respiratory droplets, and transmission is directly from person to person or through fomite or surface transmission. One of the more current concerns is this concept of aerosolization, and whether when a person is generating respiratory droplets, whether the smaller droplets, or the micro droplets as they're called, will become aerosolized and be transmitted through the air and possibly through a air handling system and transmitted from one place in the building to another place in the building. There was a very recent study done in the US. It was published in the New England Journal of Medicine, and it confirmed that the micro droplets that might get generated through respiratory, through a person's respiration, can remain airborne for up to 3 hours in an indoor environment. So what we mean by micro droplets is these very tiny droplets that behave somewhat like a gas, as opposed to a larger droplet that may be analogous to a drop of water. Much smaller, of course, but gravity is the main force that moves that droplet. So it might travel up to 2 meters and then it drops onto a surface. So these micro droplets can remain airborne for up to 3 hours. But the question that gets generated from that is, can they be transported through an air handling system, number one? And do the micro droplets contain a high enough dose of the virus to make a person sick? And again, currently, epidemiologists have studied this, and the information that we're receiving as a public from the World Health Organization and from federal and provincial health bodies is that the virus is transmitted through respiratory droplets, person-to-person contact, or surface contact. So that's the information that the engineering community are following. And currently there's no concern about transmission through building air handling systems. Now, nevertheless, there are things that condos can do to minimize the risk of transporting any airborne pathogens through their air handling systems. And two of them that have recently been formalized in a newsletter by ASHRAE are increasing your outdoor air ventilation. So on your rooftop units, you've got intake for fresh air, and oftentimes those are throttled down, and what happens is the air is recirculated within the building as opposed to bringing in 100% fresh outdoor air. One thing that you can do, especially this time of year, is open that intake fully 100% so that you have no recirculation happening. That's number one. And number two is there is some evidence to suggest that improving your central air filtration and going to something like a MERV 13 filter, which is the highest compatible filter with most air handling systems, and sealing the edges of that filter to limit the bypass is another thing that one can do. I would probably finish off by saying you should be speaking with your mechanical contractor who maintains your ventilation system to make sure that it is providing the maximum amount of indoor fresh air that you can achieve, and also to look into the possibility of upping your air filtration to something like a MERV 13. John or Evan, is there anything you guys want to add to this?
Yeah, I did some research as well on the subject in ASHRAE, which is one of the governing bodies that we get a lot of our standards and governs a lot of our standards. They have a position paper on specifically the airborne infectious disease and the HVAC systems. And one of the things that they stress, and it's stressed often, is that dilution is still one of the best, if not the best method for handling these things in our air system. And we go ahead and turn off our makeup air units, we're going to lose a lot of that dilution. And what's going to happen is there's going to be now a higher concentration of those micro droplets. So maybe at the end of this, I'll post the link to ASHRAE's position paper. I think in the coming months, we're going to see, the risk is relatively low with the airborne transmissions, but I think we're going to see, just as a general rule, people looking at better filtrations, whether it's the MERV or looking at UV or ionization strategies. So again, like Mina said, is stay in contact with your mechanical engineer and take a look at the systems that you specifically have put in place and understand those risks. But definitely shutting off the makeup air units is not something that's advised.
Thanks, Evan. John, do you have anything to add?
Yeah, just a couple of little things. So for our townhouse friends, most of this doesn't apply to you. Open up the windows, clean your filters, and pay attention to cleaning the surfaces and wash your hands again. It's very important to recognize that this is a disease that is spread by touch and close proximity to infected people. The trouble is we can't know who's infected. And so the advice that treat everybody as if they are infected is good advice. And so dilute by getting fresh air in there and filter as best you can, and then stay away. Don't have any physical contact with anyone for the next couple of weeks.
Thanks, John. All right, so we're over time, but I just wanted Michelle to give us a quick update on the fire code and what's coming through on that line. We are going to move Ashley's session on changes to essential services next week because I don't want to rush that session. There's a lot to talk about. So that'll be the cliffhanger for this week. You're going to come back next week to hear about essential services and what has changed. So Michelle, can you give us the fire code updates for this week?
Yeah, I'll keep it really brief because I know we're over time. But this week, the Canadian Fire Alarm Association has issued a bulletin regarding fire alarm and life safety systems and whether you're supposed to be going in suite or not. We've been getting a lot of calls at our office on whether that should be permitted or not. And basically, the fire alarm service companies are an essential service, so they can continue doing your monthly and your annual testing and your inspections, but they are to develop proper means of testing the system, which means for you that you should adhere to your monthly and annual testing, but you can postpone your in-suite testing. So we keep everybody safe, including the fire alarm technicians, the residents, and for those who may not want to permit anybody to come into their suite. So I spoke to the Barrie Fire Department about this today. I spoke to their senior education and fire prevention people, and they are supportive of the CFA's position on this, that there is a section in CAN-S 536, the testing standards, that allows us to have inaccessible devices. It's not typically used for this. So if you're scheduled to check your smoke alarms and CO detectors in townhouses, or you're scheduled for your monthly and annuals, you should be doing them. But if it requires suite access, then we are postponing that ahead and trying to remind everybody to try to prevent fires at this time. The fire department is asking that people test their smoke alarms and CO detectors monthly, especially in the cases where they can't be tested in suite. They're also reminding us that cooking is the largest cause. One of the people had absolutely said, don't heat your pizza in the box. They're having those types of problems. But if you're in a common residential building with multiple units, don't open your door to vent the smoke out, because the fire alarm system will go off and they don't want to respond if they don't have to. Smoking is another leading cause because it happens outside. They're saying remind your residents to use putting the cigarette butts in water, putting them in ashtrays, and to keep clutter off balconies and patios to ensure that you are limiting the fire risk around your own home. So basically, to review their fire safety responsibilities and obligations, looking for the gaps, trying to prevent fires, and communicating to your residents what your changes are, what you're going to be doing. Reach out and talk to your service providers about what their modifications to your services are, and talk to your professionals, because we're here to help, and you are going to have to make changes until this is resolved. Thank you.
Thanks, Michelle. Michelle, I'm just going to point you to the chat. There is a question about fire drills and being deferred, so maybe you can answer that on the chat line and everybody can see that.
Mm-hmm.
All right, well, this hour has just flown by, and I just want to thank everyone out there in the webinar. Thank you for joining us tonight, and I want to put a special thank you out to all of our speakers, especially our guests that we had this week. It was great to have some new faces on the line, and providing us with insight in a variety of different areas. So thank you all to all the speakers. I also just want to let everybody know that if you have questions that come up during the week, please send them in to admin@ccihuronia.com. We did have some questions that came in this week. We will try to get those questions answered during the webinar, so feel free to send those in. If you've posted the question in the chat, you don't need to send it in again, because we will be reviewing the chat box. We're also asking and reaching out to everyone on the line to send us your tips and tricks for surviving COVID-19. CCI Huronia wants to collect the tips and tricks that are out there, and we're going to compile them and then put them into a format to distribute at a later date. When you do send those tips and tricks in, please acknowledge where the tip and trick is coming from so that we can acknowledge that tip. And again, you can send that in to admin@ccihuronia.com. A recording of today's webinar will be posted on the website, hopefully within the next 48 hours. So if you want to go back and review what some of the speakers have said, you can do that. If you know other people who missed tonight and would be interested in the webinar, you can direct them to our website, and it's free of charge for them to review it. Our next webinar is going to be next Tuesday at 7 o'clock. There will be an e-blast going out, so you will need to register again. If you're not on our e-blast list and you want to get on our e-blast list, please send an email to admin@ccihuronia.com, or you can just go right onto our website and register directly for the next webinar. Until next time, I want to wish all of you safe and healthy days ahead. Be safe, be patient, be kind, and do your part to protect not only the essential workers that are still out there putting their lives on the line, but also to protect all those people who are medically compromised. Please stay in your homes, stay in your units, don't go out unless it's essential. We can all do one thing, and that's help flatten the curve, and everybody has been saying we need to stay in our homes to be able to do that. So please do that, and we hope to see you next week. And until then, I'm Sonia Hodis on behalf of CCI Huronia. Thank you for joining us, and we'll see you next week.